This hospital that she's talking about recently thwarted all attempts to keep it from dehydrating a patient to death, despite lack of an advance directive or permission from next of kin. The patient's mother disputed the diagnosis of brain death. The gastroenterologist of her choice was willing and able to place a feeding tube needed in order to transfer the patient to a skilled nursing facility. In other words, they weren't going to leave her there to rack up fees and to occupy a bed in the hospital. So it's like, no, we'll put in a feeding tube so we can take her to a nursing facility that the family will pay for. But the hospital would not permit it. Really? An outside physician on whom the mother had called was removed from the patient's room by security when she was merely praying with the mother. The mother could not get a phone call return from an attending physician, and so Dr. Jane Orient asks, who was the doctor? Apparently, the hospital system. Now, who's going to be the doctor, I ask you, when we have government-controlled health care? When they talk about a single payer, guess what? Whoever pays runs the system. And they will be the doctor. I don't want Washington or the federal government or our all-benevolent Uncle Sam to be my doctor. I don't want Obama being my doctor. I don't want Donald Trump being my doctor. Get the hell out of my life, especially when it comes to medical care. Get out. You're not welcome here. Recently, a physician called me, says Dr. Jane Orient, about her mother, who was seemingly captive in a world-renowned hospital. We've seen medical kidnapping before, haven't we? She was concerned about her mother's nutritional status and her falling oxygen level. She could not speak to the attending physician. She said they just play musical doctors. And then finally, she says, largely driven by government policy, the system is increasingly in control. And it will be if we establish a government bureaucracy. Oh, yeah. And then you're going to have the corruption aspect of this, as we see in Baltimore. The University of Maryland medical system was not the only major buyer of Baltimore Mayor Catherine Pugh's Healthy Holly children's books. Now, this is a woman who is a politician. She's a mayor, but she wrote a book for children called Healthy Holly. Healthy Holly. Now, previously, she had said, and this is a local story, but it is a universal tale of corruption. We've seen this over and over again. The mayor, Pugh, had previously said that, even though she received $500,000 from the University of Maryland medical system, that the 100,000 books that represented were her only sales. So she said, yeah, I got $500,000 from the University of Maryland medical system for 100,000 books, but those were the only ones that I sold. Well, now it turns out that she didn't just sell 100,000 books to the University of Maryland medical system. She also sold 20,000 copies to Kaiser Permanente, and she also sold 10,000 to Blue Cross Blue Shield, and she is overseeing these organizations. That's called payola. More interesting is the fact that if you're keeping track of this, right, it was 100,000 to the university, it was 10,000 to Blue Cross Blue Shield, and it was 20,000 to Kaiser Permanente. 130,000 books. Guess what? Her printer, according to the Baltimore Sun, who did the research, because, they actually do investigate, unlike CNN. CNN says, we don't investigate. Well, you better, if you're going to be news, you better investigate, or you better check up on your facts. But no, they're fact-free. But these people actually did an investigation. They called up the printer and they said, how many of these books did you print? Because they're wondering, are there other people who are paying her for this? Because first she said it's only the university. Then we find out it's these other companies that she was in charge of regulating. And so they're wondering, well, how many books are out there in circulation? It said, we only printed 60,000 and we don't have any orders to print anymore. But she claims that she sold 130,000 and she isn't printing any more than 60,000. Problem on top of problem. Pugh, a Democrat, of course, became mayor in December of 2016. By September of 2017, the city's spending board, which she sits on and controls, awarded Kaiser Permanente a $48 million contract to provide health insurance to city employees. She does not appear to abstain from voting on the contract, even though she clearly would have a conflict of interest. So you see how that works? Kaiser Permanente buys 20,000 copies of her book which they don't even have to, give anybody because they don't exist. She's already sold 100,000 copies of a book. She only has 60,000 copies. That's why they said, here, we'll buy another 20,000 for $100,000. Now, they put down $100,000 and they get a $48 million contract. You want to work out the return on investment for that? Well, it's about 480 times is what they did with their money, right? Which is about 48,000% return on investment, just off the top of my head, if I got the math right. A 48,000% return on investment. Hey, that's a deal. So these are the people who should be running our healthcare and determining what we're going to have. It's just as Amazon is banning a vaccine documentary, you can still buy child sex dolls on Amazon, but you can't talk about vaccines or about health issues. Folks, you cannot separate your liberty from your medical care, and you cannot separate your liberty from your free speech. If you want to protect us here at InfoWars, because we have been at the forefront of the attacks to shut down free speech, as I pointed out earlier in the broadcast, Mark Zuckerberg now is begging for global governance of your speech. He wants a set of rules. He's more than willing to do business with the dictators, as long as they cut him in on the money. We don't operate that way. We want free speech because we want freedom. And we want free access to health care to make the decisions. We don't want free health care because it comes with strings attached. But there are strings attached if you want freedom, folks, and the price of that is to support us here. And you've been very good about that. We have responded with a massive